Good Friday afternoon. I'm Dr. Martha Buchanan, Public Health Officer and Senior Director of the Knox County Health Department. Our moment of gratitude today is for all our mothers in the community. Whether you have children or are a mother figure to someone, we want to extend our gratitude to you. We know Mother's Day is going to look a little different this year, but we are thankful for the families that will be creative in celebrating the wonderful moms in their lives. Moving on to our local situation. We have 272 confirmed cases of COVID-19 in Knox County. Additionally, we have 2 probable cases. 212 of our cases have recovered. 36 individuals have been hospitalized at some point in their illness. 3 are currently hospitalized. We are thankful again today to report no further deaths from COVID-19. We're also thankful today to have Dr. Keith Gray, Chief Medical Officer at the University of Tennessee Medical Center, here to talk a bit about ongoing efforts in our hospitals. I'll now turn it over to Dr. Gray.
Hello and good afternoon to everyone. I want to echo Dr. Buchanan's sentiment and offer my wife and all moms out there a happy Mother's Day, and also to my mom and mother-in-law who have been great influences on me and have allowed me to be here before you today. The last time I was with you, we were preparing for the worst of what COVID may bring to our community. One thing that I have been proud of throughout this whole process is our ability to work together as a community, for the health systems to come together to form a strategy to combat COVID-19 in our community, but also our ability to work with the Knox County Health Department and follow their lead, and also work with our county and city mayors. After having been on many Zoom calls and many telephone calls over the last 6 weeks, I am not reluctant to say that we have been among the leaders in collaboration throughout the state and maybe even in our nation. I want to give you a couple updates related to reopening, because as quickly as we had to prepare for the worst, we had to pivot and start thinking about how to reopen when we realized that at least currently the burden of disease was not what we had anticipated in our community. Our goals have remained the same. One is to maintain patient and team member safety during our reopening. 2 is to continue to provide stewardship of our personal protective equipment. And 3 is to maintain capacity, and in the event we were to see a surge, and to pivot quickly if we saw numbers increase in our community. But prior to reopening, we had to prove to ourselves that we were ready. We looked at a lot of data that proved that to ourselves and also to our community. Specifically looking at the Vanderbilt model, maybe not the latest update, but at least at the time that we looked at it, it showed that if anyone in Tennessee was ready to reopen from a healthcare standpoint, and maybe even from other standpoints, we were. We looked at what's called the R0 value, or the spread of disease from one person to the next. And at least per that model, we had the lowest rate of spread in the state of Tennessee. So that was one piece of evidence that we looked at. Also, we had to show a 14-day downward trend in the incidence or new case prevalence of disease in our community, and we were able to demonstrate that as well. And so based on those 2 pieces of data, in conjunction with other data, we decided that we were ready to begin offering those quote unquote non-essential or elective services in our health systems again. All of the systems, again, we've walked arm in arm throughout this entire process, and we decided to do it again as a community of systems. Our focus, and this is a quote from one of my colleagues, is that we would transition from operating transition to operating a hospital in the setting of COVID-19 and not operating a COVID-19 hospital. And that's a big frame shift, a big mind shift for something that we had been spending 80 to 100 hours a week on up until that point. We wanted to resume those elective services or non-essential services that we had abandoned or ceased to provide that capacity, but we stuck to our goals that we had prior to COVID. We wanted to continue to provide safe, effective, efficient, and value-based care for all of our patients in East Tennessee. We reopened 2 of those elective services on Monday, May 4th. And for those first 2 weeks, our plan is to really limit those to outpatient services, meaning for surgeries and procedures that are done on our campus where you can come, have that procedure done, and leave the same day And for those patients that require just a one-night stay, we're trying to focus our early offering to just that population of patients. That allows for a gradual increase in volume on our campus, but again, keeps our patients safe, keeps our team members safe, and doesn't overpopulate our hospital prior to us knowing what the trend of disease will be in our community. We will continue that through May 15th or through the business day of May 15th. And on May 18th, we anticipate adding low-risk inpatient procedures. And then on May 25th, adding all procedures and services back to our campus with a hope, again, barring any significant uptick in the burden of disease in our community, being open to all procedures and services on our campus by the end of May. So your question you would have is, what is your ability to downregulate or to adjust your tempo should we see a change in disease in our community? We're looking at our testing capacity. We're looking at the burden of disease. We're looking at our PPE availability. Because we are doing surgery again, we're looking at blood bank capacity and obviously our need to surge. Just like you've seen on the Knox County Health Department website, we have internal dashboards within each system that we monitor on a daily basis. Not only does the leadership have access to those dashboards, but they're forward-facing for our team members. So our team members know exactly where we are from a tempo standpoint, and they know exactly the reason why we need to pivot if that need arises. We will continue again to keep our patients safe. We're asking all visitors to wear face coverings on our campus, as well as when you're out in the community. We are wearing face covers as providers on our campuses. We are screening all of our patients as they enter our campuses. We are screening all of our team members when they arrive at work on a daily basis. And again, our same visitation restrictions continue to be in place. Your next question may be, when are you going to revisit those visitation restrictions? Again, when we know more, we're continuing monitoring those on a daily basis, but when we know more about the trajectory of the disease after this reopening, we will again consider modifying those visitor restrictions. Just a couple more things. One thing I'll say is that, the new normal may not look like the old normal, and I almost can guarantee that it won't. Despite everyone being impacted by COVID-19 negatively, I should say, there are some good things that have come out of this crisis in healthcare. And the one thing that I will name is telehealth. Telehealth was a gap in the East Tennessee community prior to COVID. People had talked about it. Some people were doing it, but it wasn't widely used among healthcare systems in our community. Now telehealth is a part of our daily operation, and we'll never go backwards. That is a benefit to the provider, and that is also a benefit to the patients that we serve. There's uncertainty ahead. I think everyone realizes that, but our goals won't change. We'll always strive to keep our patients safe. We'll always strive to keep our team members safe, and we will always strive as collective healthcare systems to offer the highest quality of care to all East Tennesseans. And lastly, whatever the road ahead looks like, I think we're prepared. I think we've established a foundation of communication that will serve us well, whatever happens in this community. And the road ahead, from my standpoint, is filled with communication, transparency, and trust. And I hope that you will hold us accountable for that as we move forward. Those are all the prepared statements that I have. And then I think we're open, Dr. Buchanan and I are open for questions, and I'll step back and let her take the podium.
All right, we'll start running through some of these questions. If you can please put in if your question is directed to Dr. Buchanan or if it's directed to Dr. Gray, that would be appreciated. All right, here we go. Sorry, a little bit of technical difficulties over here. The first question looks to be for Dr. Gray. It's from WATE. It is, will all Knoxville area hospitals adhere to the May 18th inpatient date, or is that just for UT Medical Center?
In general, those are general guidelines. I think each individual health system is adjusting that guideline based on their patient population. For example, obviously we have one main facility in Knox County, but other systems like Covenant and Tenova have several satellite facilities, and it may vary by facility. So in general, that is the general guideline, but you can expect that may be adjusted by the different systems.
Next question is for Dr. Buchanan from WVLT. What can KCHD release about the new case clusters? How many people have been affected by these clusters?
So we talked about that yesterday. There have been 12 people affected by the cluster, And we released the information we're going to release yesterday. It's connected to some large households. The people that are involved have been contacted and placed in isolation and given instruction or tested as indicated.
These next couple questions are also for Dr. Buchanan. I understand there were 26 employees furloughed out of about 260. How were the furloughed employees' roles? Or what were the furloughed employees' roles?
So one of the things to understand is that when the pandemic started and we started our response, part of our response was to go into what's called our continuity of operations plan. And that meant we stood down some services or reduced services that we normally provide. And some of those services were in the community, and those services or outreach processes stopped. So some of the folks that were furloughed didn't have a whole lot of regular work to do, and were not working in the response to COVID-19. So we're able to furlough those folks. And we also have the option to bring those folks back as needed to respond to COVID-19, as we've talked about previously.
And I believe Dr. Buchanan answered a few of your questions there, Laura, but another question is, how long are the furloughs and when did they start and when are they over?
So furlough begins Monday, May 9th. And right now the set is for 2 weeks or 8 weeks, I believe. That is set by county HR and will be determined whether that's extended by county HR and the mayor's office.
The follow-up question is, how much money do the furloughs save?
Countywide, they save the county, if we do full 8 weeks, about $1.7 million. I don't have that dollar amount specifically for the health department.
Another question, do you expect budget cuts in the next year in the health department? If so, how much and in what areas?
So the county finance is still working on the budget. It's not finalized. So we'll see that soon.
Another question, do you expect staff cuts in the next year in the health department? If so, how many and in what areas?
So we've submitted our budget to county finance. They're working through that and will be meeting with us soon about the details of what that looks like going forward.
And it looks like the last question, I believe she's answered all the rest of your questions with some of her answers, but the last question is, have the furloughs affected your ability to handle other duties? And if so, which ones?
So they haven't impacted our response. And as you can imagine, the majority of our staff, well, it's about 50-50. A lot of our staff right now are dedicated to the COVID-19 response. So a little over 100 people. And then around 100 people are also providing family planning services and WIC services. We've restarted restaurant inspections. So it has not impacted our services. We were able to change how we deliver services, allowing for some online delivery methods and not having to have in-person services, which actually speeds things up and requires fewer people. But we'll be resuming those soon and the anticipation is that we'll bring folks back after the furlough is over.
These next couple questions are for Dr. Gray. From WBIR, are hospitals concerned that with the reopening, there might be renewed strain on the healthcare system with increased cases? And how are leaders preparing for that?
So as I mentioned before, are we concerned? Are we vigilant? Yes, and we will be vigilant for a long time going forward. I think COVID-19 will be with us and a part of our conversation for the foreseeable future. And so part of that preparation is the dashboard that we talked about. The big dashboard facing forward for the community is the Knox County Health Department dashboard, where we're looking at trends in new cases. We're looking at our ability to surge if we need to. We're looking at test turnaround time and testing capability and capacity. We are also looking at all of those things on a more granular level internally within each system. We believe that if we were to see an increase in cases, it's not going to happen overnight. And by saying that, we have the ability to downregulate or cease services that we offer that are non-essential, just like we did before, and even be more aggressive. If you recall, from a CMS, from a Centers of Medicare and Medicaid Services standpoint, we only ceased the tier 1 services. There's a tier 2 and tier 3. We could really go back to tier 3 and create even more capacity if we needed to. But to answer your question directly, we are remaining vigilant and monitoring trends that were previously mentioned on a daily basis.
Another question from WIR for Dr. Gray. What looks different for patients going to UT Medical Center these days? You said staff are screened daily. What does that screening look like?
So it's not just unique to UT Medical Center, but I think it probably applies to all the medical centers, at least around our state. and we know that from our state calls, but maybe even around the country. Number one, visitation is restricted. No non-essential people on campus, meaning if you need services from our campus, obviously our campus or any other campus, you're welcome there, and to be accompanied by one adult for that service. But we're not allowing people to stay overnight in our facilities, and that is consistent throughout the city. Every patient will be screened at the entry points to our campus and all other campuses. That will include question about symptoms, question about contacts, question about questionable travel or high-risk travel, and a temperature check. Also, our team members and providers on every campus are undergoing that same screening on a daily basis.
The next couple questions are for Dr. Buchanan. From WBLT, today the state is reopening venues like bowling and mini golf. Gyms have, I think the Mid-States gyms have reopened in Knox County. When will KCHD allow these venues to reopen?
In allowing what are called indoor leisure activity facilities to open is not part of our phase 1 plan. It will be considered for phase 2.
And from WBIR, questions on testing. How many people has KCHD tested so far?
So since the 4th of March, we have tested a total of 2,552 people, and only 41 of those have been positive.
Another question from WBR on testing is how many people can KCHD screen for COVID in a day? Have you been meeting that capacity?
So we are prepared to be able to test 100 to 150 people per day during the week in our regular weekday testing. We are also capable of doing on-site testing for clusters, or like at a nursing home, or the clusters we talked about earlier today, or special event testing. We're also looking at doing what we're kind of calling pop-up testing, smaller events focused on neighborhoods to get at-risk neighborhoods access to testing. And that'll be happening usually during the week. We'll be doing regular testing on Monday, Wednesday, and Friday, doing kind of special testing on Tuesdays and Thursdays.
Another question is, what was your testing schedule this week and what is it next week?
This week it was Monday through Thursday. Next week it's going to be Monday, Wednesday, Thursday. Monday, Wednesday, Friday, and then reserving Tuesday and Thursday to do outreach or special testing.
The next couple questions are for Dr. Gray. First question is from the Compass. What has been the impact on emergency room visits?
So interestingly, we saw a decrease in overall emergency room visits during our safer at home policy and strategy. Now that we've opened up, we've seen an increase in those visits for all reasons, obviously not just COVID related reasons, but for all reasons. I think as people resume some fraction of their normal activity, problems that may not have been an issue in the past because they weren't very active may now become an issue, whether that be cardiac issues and chest pain, or whether that be accidents, which is probably a leading cause of ER visits. But to answer your question, we've seen an increase in our ER visits over the last week.
The next question is from WBIR. They say it's along the same lines as the question you just answered. They say across the country, hospitals are reporting drastically lower numbers of patients presenting to emergency departments. Is this true in our community? Previously, we've spoken about overcrowding in emergency rooms with people who do not need emergency care. In an unusual way, has COVID-19 pushed people to urgent care or other options rather than emergency rooms? And
so to answer your question, yes. Again, we saw a decrease in our overall ED visits during our safer at home time. Will COVID-19 push people to use urgent cares? Time will tell. We hope it pushes us to a more appropriate use of emergency services. And maybe it's just a wake-up call and letting people know that for things that they thought were emergencies aren't really emergencies, and they can manage it with their primary care physicians. We always advocate for that, but obviously when people need to use the emergency department, we encourage them to come.
Similarly to your answer there, their follow-up question was, on the other hand, are you concerned about people not going to the emergency room who need help because of COVID-19 fears?
I think that is a real concern. And along those lines, we've seen folks to have exacerbation of their chronic disease during this time due to lack of fear of what they may encounter in a COVID hospital, if you will. This is an opportunity to reinforce that, again, that we are offering a safe environment in the healthcare system. Again, we're asking visitors to mask themselves, the providers. I know that all 5,000 of our team members at the University of Tennessee Medical Center are masked, protecting you from us. We hope that you will protect us from you. And that is part of our way of creating a safe environment. And again, the same thing holds true in the community. By wearing your mask, you're not protecting yourself from others, but you're being compliant and protecting others from you. If everybody does that, then everyone's protected.
All right, any other questions that you have for Dr. Buchanan or Dr. Gray? Another question just came in for Dr. Buchanan. From WBIR, the governor said unequivocally yesterday that every health department is open 5 days a week for testing. Is there a reason why KCHD has not been?
We are open for testing 5 days a week. We aren't always doing drive-through testing 5 days a week. We're doing drive-through testing usually 3 or 4 days a week, but then doing those more specific tests, the more specific testing that we need to do on the other days. And we're also available for walk-in testing for folks who need to be tested. When we're doing our contact investigations, if somebody needs a test, they can come here to get tested as well.
Their follow-up question is, are you looking to boost daily testing even more now? Do you feel that it is needed?
I think with all the community testing that's happening, hospitals opening up to non-essential services, they're doing more testing. Providers are doing more testing now. So with the increase in testing in the community, we feel really comfortable with the level of testing that we're doing with some special events and some outreach. We have to remember to reserve our testing supplies for specific things like clusters or nursing homes, because we have to respond to those differently than the community providers do.
Right. They say, thank you for the clarification on the testing. Another question from WBIR. We've asked this, so forgive me. How likely is someone in our community to die from coronavirus compared to other common causes of death like heart disease or cancer? Is that even a fair comparison?
It's really not a fair comparison. You know, our COVID-19 deaths are only 5 at this time. So it's really, there's no way to compare it to anything else. I think given our disease rate, we're having 5 or 6 new cases a day. The likelihood of somebody dying from COVID-19 is very, very low. The likelihood of them even going to the hospital for COVID-19 is very, very low. So the concerns about, certainly people die from COVID-19, and I know I've seen some data that there's concerns about there'll be an increase in COVID-19 deaths in the near future. We won't know if we're going to see that here in Knox County or not.
Okay, any other questions? We got time for just about 1 or 2 more. This one also for Dr. Buchanan from WBIR. State officials yesterday said they're going to be doing mass testing of residents in urban public housing. Is that going to happen here? And if so, when?
So that is going to happen here. That is being managed and scheduled by the National Guard. And we're working with them to do that. And I do not have those dates off the top of my head. Somebody else is coordinating that, but I do know that's happening. The state is also helping coordinate testing in long-term care facilities. We'll be working with them on that, as well as assisted living. Sorry, thank you.
Another question for Dr. Buchanan from WBIR. What has the demand been for masks? How many have you given out, and when do you anticipate needing more?
As of yesterday, we've given out 2,000, and we got about 19,000 in a shipment. We're expecting another shipment. So we have plenty. We're working with community partners to get them out in the community for folks who've expressed a need or expressed a desire to have masks. So we're working with community partners who serve the under and uninsured and other folks.
All right, just about time for 2 more questions. So one of those just came in from WBIR. They say, last one, thank you for indulging us. Can you talk about how many members of our homeless community have now been tested and what those numbers look like?
We do not have that data on homeless people specifically. Again, the number of people being tested are not just being tested by us, they're being tested by several other groups. And so we don't have that data on the number of people being tested specifically. It has been, the ones that we are aware of has been a very small portion of testing being done in Knox County.
right, last call for questions. All right, thank you everyone for joining us, and thank you to Dr. Gray for joining us as well. We hope you have a good rest of your